Hospital District Foundation, Jeff, Veronica, the board, for selecting the Food Pharmacy program as the beneficiary this year. And thanks to each and every one of you and the organizations that you represent for supporting this golf tournament. As many of you know, Harris Health's mission is to serve the underserved with quality care. And more we're learning that health outcomes are tied to things that happen outside of our clinic walls. So the neighborhood that you live in, access to healthy food, access to reliable transportation. And for nearly 1 in 4 of our patients, reliable access to healthy food is a concern. We all know that healthy diet is a critical component of managing chronic diseases, preventing further complications. So that's where this idea was born. The Food Pharmacy was really born out of the idea that through strong partnerships with community organizations such as the Houston Food Bank, we really can help shorten that distance between our patients and their needs and show improvements in their health. So it's not just feel-good stuff, we're actually seeing improvements in their health.
So what does that actually mean? So what does your support actually mean? In last year's efforts, we saw over 11,000 patients. This year alone, we've increased that number to almost 22,000 patients as of Friday, so November 30th. And we project to see over 25,000 patients this year. What does that mean as far as pounds of food? It's about 700,000 pounds of food that we distribute out to patients. And when we talk about patients, yes, we're giving 30 pounds of fresh fruits and produce for up to 2 weeks for a patient, but that means a family of 4. And a family of 4 is able to eat these healthy food options. Most of the food that we provide our patients from the food pharmacies, I should say, are from the Houston Food Bank. So most of the food comes from the Houston Food Bank. Your support, your sponsorship helps us supplement the food so that we're able to allow nutrition variety in the patient's diet. So not that they're just getting 30 pounds of like onions and sweet potatoes and some bananas, but we're able to give them other things to make that, so you actually eat that food. It's not nutrition if you're not eating it. Aside from the food, it helps us maintain the appropriate equipment and IT needs to allow us to see the maximum number of patients on a regular basis. In less than a week, and just this Monday, your sponsorship has also been able to allow us to expand our reach. And so we had 7 food pharmacies last year. We're up to, we had 7 locations last year. We have 7 food pharmacies, 3 community redemption sites, and this week we'll have 2 food lockers placed at 2 of our locations. So this is a new innovative way to give patients access to this healthy food where they can use a QR code, come in after hours if needed, and pick up their food. Now, food pharmacy, the work that we do is not just about the food. We're not gonna get there without the education. So it's about making sure that they're not just connected to food, but they're connected to the nutrition education and nutrition support, and that they're seeing their doctors on a regular basis. So in less than a week, we'll have 12 sites throughout. And just as a knowledge and as part, so many of you all bought raffles, and we're gonna be doing some raffle tickets. 1 raffle ticket is helping support a family of 4 for a week. So every raffle ticket that you bought. And when you're thinking of bigger sponsorships, and if you wanna give us more money, a $25,000 sponsorship would be able to support a whole food pharmacy for a whole year. So that's about 700 patients that will be receiving food on a regular basis.